Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
How you are going to treat the patient with tracheoesophageal fistula. So, treatment is obviously we should do a surgical repair. You should remove the fistula and do tension-free esophageal anastomosis should be done. If this is the tracheoesophageal fistula, you should remove it and then do a tension-free esophageal anastomosis should be done in the patient. So that is the surgical treatment of tracheoesophageal fistula. For example, the fistula is if this is the trachea and the fistula is proximal esophageal fistula with distal atresia, then you will remove the fistula and then you will do a tension-free esophageal anastomosis will be done. Okay. Then one more important thing is the outcome of the tracheoesophageal fistula. The outcome of the tracheoesophageal fistula is mainly related to the present anomalies like the chromosomal abnormalities and the cardiac defects which are associated with the tracheoesophageal fistula are the main things which are important in the outcome of the patient.
thank you and thank you for watching.